Okay. Welcome to another week. Week 12 this time around for our psychological testing. Week 12. Like I've said, that the week have changed. Others are 11, but we are now in week 12. So this week, we're going to be looking at integrating assessment into pastoral case formulation. We'll be looking at biopsychosocial-spiritual model, treatment planning, and referral. Again, some of you, if you are staying in pastoral ministry, there's a limit to how you can use all this model. But for those of us who are very smart, we can begin to introduce some of all these things to what we do. That is what will make you different from people who don't have PhD. The approach you give to your ministry, your work, must not be the same with people who have never been to school. Some of these things should be popping up. People should see sign that this one is a learned man in our ministry henceforth. So pastoral ministry increasingly requires the integration of theological insight with sound psychological assessment. This week 12 now, focuses on how to move from assessment to pastoral case formulation using a psychosocial-spiritual framework, BPSS framework. This approach enables pastors, chaplains, and Christian counselors to understand to understand individuals holistically and respond with appropriate care, appropriate intervention, and make necessary referral when we need to do that. They brought a case to you, somebody to you as a pastor. Maybe you are the first point of contact. With your knowledge, you should be able to look at the situation and take the right step. That's where this is applicable. Now, what is pastoral case formulation? Case formulation is a structured way of understanding a person's presenting concern by identifying the contributing factors, strengths, and needs. Okay? Your understanding of a person's presenting problem. They brought a problem before you. As the person is telling you the problem, you are able to identify the factor, the contributing factor. You are able to identify what is the need of this person. You are quick, you are smart in doing the right thing. In pastoral care, it includes spiritual interpretation of suffering. They presented that case. You are able to conclude in few minutes whether it's a spiritual problem you need to pray about or a hospital problem. All right? Somebody died some time ago on the mountain where they are praying. When he needed medical attention, they were praying for him on the mountain. That shows ignorance. A pastor was telling me that a client died, that the bottle of oil they packed from his stomach. He was sick and he was drinking anointing oil. All right? He didn't seek medical consultation. So there's a need for you as a pastor to listen to a case and know what to do. You understand whether it's a psychological or emotional, problem. You understand it. Whether it's a social or relational context, you are able to discern care and intervention. Okay? Unlike purely clinical models, pastoral formulation integrates faith, meaning, and spiritual direction. That's what makes us For those of us who are working in the mental health and at the same time we are pastors, it helps us to combine all these things together. All right. So let's look at biopsychosocial-spiritual model, the BPSS model, which expands traditional psychological assessment to, by including spirituality into it as a core dimension. Okay. You are looking at it holistically. Biology, psychological, social, and spiritual. You're looking at it all around. You're looking at a biological dimension, physical health condition, sleep pattern, nutrition, medication, neurologically or genetic factor. You are able to look at the situation in that manner, from that perspective, that lens. The pastoral insight there is that physical issues can affect spiritual and emotional well-being. So if somebody is going through illness and the person needs medical attention and they are praying in church, you should be able to look at this. Is this matter a biological issue? Because it has to do from that biological dimension and know what to do. Psychological dimension, psychological dimension. You're looking at the thoughts, emotions, and coping style. You're looking at the mental health condition. Is it anxiety or depression? Is it a trauma history? Is there any trauma history there? Emotional struggle may shape one's perception of God, self-worth, and all. So some people are going through psychological issues, it shapes their understanding, their perception of God. But you, as a leader who knows, who understands, should be able to use all these lenses to look at the problem. Another aspect is social dimension. See if relationship matter. See a community or church issues. Is it a socio-economical issue, condition, or cultural background issue? So that's social dimension. Okay, pastoral insight there is that isolation or conflict can hinder spiritual growth and resting. So you must be able to look at, you're asking people to pray when you are not solving the problem between her and her husband. You're asking them to pray. So when you look at it from all sides, you should know that this is not just a spiritual problem. This is a social issue that you may need to intervene as a pastor. You're not just saying, come to church and come and be praying. When such situation need intervention. Spiritual dimension, which has to do with relationship with God, or faith practice of prayer, worship, and all that. Belief about suffering, sin and grace, spiritual struggle, doubt, guilt, dryness, and all that. So we must be able, when they present a case before us, you must be able to look at it with these lenses. That will help you to know what to do. Okay. Let's give an example. Integrated assessment to case formulation. A good pastoral formulation will answer the following question. The first one is, what is the presenting problem? What is the presenting issue? The second one is, what factor contributed to this problem? The third question is, what maintains the problem? Another one is, what strengths and resources are available? Number 5, what is God doing in this situation? So you must be able to look at any problem brought before you from that perspective. And that will help you to form a treatment plan for this person. Does this person need support? Does he need hospital? Does he need prayer? Does he need counseling? Do we need to monitor? Goal, intervention, timeline, and evaluation. Okay, you will know what to do. And if it is beyond your power, then you refer the person, take the person to the hospital or somewhere else, to somebody who can help. If it's a spiritual issue and it's beyond you, you refer to a senior spiritual person to take over the matter from there. Okay, we make a referral. It can be mental health to mental health professional, it can be medical doctor, it can be to social services, it can be to specialized Christian counselor. And you must maintain, confidentiality, informed consent, and collaborate respectfully with other professionals. when this is happening. So it must be biblical grounded, full of truth and grace. It must be psychologically informed, evidence-based understanding. You must be spiritually sensitive, discernment, and prayer. So it's not just a pastor sitting down in 21st century in church praying alone. You must be able to integrate all these things to whatever you are doing. Okay, this is great. So, and we need to develop listening, skills. You must be able to listen to people very well and understand what they are saying. And when you're talking to them, you're using open-ended questions to ask. You are not just concluding premature spiritualizing or psychological issues. You're just jumping to conclusion. You are not recognizing personal limitations. You're not documenting anything. We must be organized. That's the purpose. We must have office and have people who are working with us, and everything must be in order, because even this part of the world, it's compulsory. You have to keep files and notes and all the clinical notes and all that. Okay, we must be able to do all these things. So integrating assessment into pastoral case formulation allows caregiver to respond to individual in a holistic, compassionate, and effective manner. These lenses we are talking about ensure that no dimension of human experience is ignored. Through thoughtful treatment planning and appropriate referral, pastoral caregiver can support healing, can support growth, can support spiritual renewal. This is very, very important. So that you are not just dealing with one thing from one side. I say you look at the issue holistically, and you know what is the problem, and then we determine what can you do. I hope you will read the what we're supposed to read for this, the text for this week, to have more understanding about what we are talking about today. All right. If you have any question, feel free to let me know, ask me, and I will explain further to it. But like I've said, I'm not doing detailed work because you may not need it. For some of you who will be going deeper into psychology, you may have to do all these things later on in the midst of it when it